Here at home, it's not a matter of if, but when and where the coronavirus will first hit in Canada. Local officials providing an update earlier today. Now, they say they are ready for whatever comes, thanks to the outbreak that happened, the SARS outbreak back in 2003.
We're ready. We're prepared.
No need for alarm just yet. That's the message from Toronto Public Health.
People are going to be assessed. Will continue to be assessed. That's part of our surveillance, and we're going to get more and more of that as we rule out any possibility of cases here in Canada.
Ontario's Chief Medical Officer of Health says while he does expect the coronavirus will make its way to Canada, the overall risk to Torontonians is being considered low. That's largely due to lessons learned since the 2003 SARS outbreak and advancements in lab testing made since.
Light years ahead what we faced back in 2003. We learned lessons. We grew through that. We have had practice through Ebola, through H1N1, and through MERS-CoV, another virus. So here we are again. We're going to step up to the task. Ontario's ready.
One of those advancements includes speed. Officials saying they already have a specific and reliable test which can identify the coronavirus in as little as 24 hours.
This was a disease unknown to science only 2 weeks ago. And we now have the full genetic fingerprint of the virus.
The coronavirus has killed 26 people so far, and the number of confirmed cases has risen to 830. This weekend marks a busy travel time in the Chinese Lunar New Year. Officials say their attention will be focused on travel hubs such as Pearson Airport, where protocols are already in place.
We find out about the circumstances under which they became ill, who they might have contacted so we can control the spread, and the settings that that person might have been in order to understand, look, is there a risk that others were exposed?
While there are no confirmed cases in Canada yet, an unknown number of people have already undergone voluntary testing. Some of them have traveled to Wuhan, China and surrounding areas, the epicenter of the breakout where millions are under lockdown.
If a case comes here, and it is probably likely that we will have a case here, folks, it will still be business as normal.
The initial symptoms of the coronavirus can mirror that of a cold or flu and can worsen to pneumonia. Now, Ontario has made this reportable under the health legislation, which means medical professionals will need to report any cases of the coronavirus to public health.